Hello, I'm Len Berry. I'm a professor in the Mays Business School at Texas A&M University. I'm a longtime health services researcher, and this year I'm a senior fellow at the Institute for Healthcare Improvement, IHI, here in Cambridge, Massachusetts. My co-authors and I have just published an article toward a strategy of patient-centered access in primary care. This article is now published online in Mayo Clinic Proceedings, and it will be in the print version of the journal for October. Our article offers a comprehensive blueprint for patient-centered access in primary care. A blueprint for delivering service to patients where they want it, when they want it, and how they want it. There are a variety of articles on very specific aspects of access. You find a lot of literature on email communications or a lot of literature on group appointments and other specific access alternatives. But there's very little literature that puts all of these ideas together into a comprehensive and strategic framework or blueprint. We've tried to do that in our article. So why should primary care practices even care about improving access? After all, there's this predicted shortage of primary care doctors. There's the Affordable Care Act, which is bringing more patients into the marketplace. Many primary care practices have full patient panels today. So why care? Well, there's a couple of reasons. One, the consumer's definition of convenience has changed dramatically in recent years, in part because of the rise of the internet. What used to be fast is now slow. What used to be acceptable is now unacceptable. And patients are no exception to this changing definition of what convenience means. And this has led to the rise in healthcare, in primary care, of what we call in the business school intertype competition. Intertype competition is competition for the same customer among dissimilar competitors. So in effect, it's different kinds of competitors competing for the same customer. And this is happening in primary care. Today, for example, in 2014, there's more than 1,500 medical clinics in retail stores, in drugstores, in supermarkets, walk-in clinics, no appointment needed. And that number is expected to double in the next 12 months. Today in the United States, there's more than 8,000 urgent care clinics. 8,000, and that number is growing. Today in the United States, more than 1/3 of companies that have more than 500 employees in one location have an on-site medical clinic in their building. And what's happening with these intertype competitors is they are drawing away a growing proportion of the approximately 50 million low acuity medical visits that occur in the United States annually. And the implication of that, looking at that from a business school professor's perspective, is that the walk-in clinics of one kind or another are drawing away the least complicated patients and the revenue they bring, leaving primary care practices, the traditional ones, to the more complicated patients to serve. So our article presents a blueprint for changing an approach to access, making it more convenient, making it more appealing, making it more satisfying to your patients. We discuss in the article different aspects of the physical practice. We discuss in the article different aspects of what we call a remote practice. We use different examples to illustrate each access pathway. And these are examples that are being used successfully somewhere in the United States today. So everything in the article can be done, A contribution of our article, I hope, is simply to bring all of this information together in one place. From in-person office visits, to group appointments, to telemedicine, to various web-based services, these are some of the cornerstones to developing a patient-centered access approach. Our article emphasizes the importance of medical teams, including the use of non-physician clinicians to serve patients and to improve access. Our article emphasizes that patients always need assistance, but do not necessarily always need an in-person visit with a doctor. Our article emphasizes that improving access to patients will improve patient loyalty, improve patient satisfaction, improve clinical quality, improve practice efficiency. Done the right way, all of these outcomes are likely. Just imagine, once you read our article, if the VA would have used a system similar to what we portray in our article. Just imagine what could have happened. I think it would have avoided the scandal, the tragedy that has engulfed it, that has tarnished its reputation, and that has harmed its patients. So thank you for listening. I hope you'll take a look at the article.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.com. This video content is copyrighted by Mayo Foundation for Medical Education and Research.